As this is Super Bowl week, and I'm a huge fan of football, I think a lot about the concept of the 12th man. Started originally at Texas A&M in the 1920s and later adopted by the Seattle Seahawks and then many other sports teams. The concept is that there's tremendous power and influence by those who support the team. The loud, cheering fans in football, or in healthcare, it could be the clinical care team, the family, the parents, the siblings. Today's episode is dedicated to this concept of the 12th man, but in pediatric healthcare.
Welcome to the Dose of Optimism, where I talk to the optimists in healthcare. My name is Omkar Kulkarni, and I work at one of the world's best children's hospitals, where I lead innovation. I started KidsX, which is a premier international startup accelerator for pediatric innovation, and over the years, I've met thousands of startups, investors, and innovators. Every one of them has a story, and every one of them is optimistic about the problems they're solving. On this podcast, you'll meet amazing people who will share their stories and what makes them optimistic about the future of healthcare. A little note before you get into this episode. This podcast is for informational purposes only. We are not offering medical advice, and we're not endorsing any products. Please talk to your own physician about your health or the health of your children. All right, let's get started.
We want to start by celebrating the patient safety advocates who support our clinicians, our staff, and our patients to make sure that we're delivering the safest care to patients in children's hospitals. Anne Lyren, Chief Medical and Strategy Officer of a really important network called Solutions for Patient Safety, is my first guest. So tell me more about the Solutions for Patient Safety.
The Solutions for Patient Safety is a collaborative of 150 plus children's hospitals across the United States and Canada that is working together to try to eliminate serious healthcare associated harm. It started about 15 years ago in the state of Ohio when a group of enterprising CEOs decided to come together, bring the 8 Ohio children's hospitals together to work on eliminating harm related to medication errors and surgical site infections. And what happened was pretty magical. Over the next couple of years, we reduced adverse drug events and surgical site infections by over 50%. So this caught the attention of the federal government, and they issued us a challenge to spread this work across the country, which we did. And 15 years later, we have this network of 150 hospitals in Canada and the US and have had some really phenomenal results. In fact, we recently passed the 33,000 children spared serious harm and averted hundreds of millions of dollars in healthcare money that is spent when children get injured. So it's a really amazing network of hospital leaders that have organized their hospitals to work on safety and with really effective, great results.
First, why are there 8 children's hospitals in Ohio?
That's a great question, including some like in the city of Cleveland, there are 2 children's hospitals that are 300 yards apart.
Wow. I mean, to have 8 organizations in the same state, I imagine they're competitive with one another, and for them to get
Yeah.
together to solve this and scale it nationally and internationally is amazing. So KidsX, which is an organization that I run, and SPS started talking a little over a year ago about how we could bring digital innovation, digital solutions to help improve patient safety in pediatric hospitals. And we came up with this idea for an innovation challenge.
When we first started working together, there was so much low-hanging fruit for trying to go from arbitrary processes to standard processes, and how you take care of a child who's on a ventilator, how you take care of a child with a big IV, how you take care of a child and prevent him or her from falling out of a bed, et cetera. And so that was the focus of our work, was really standardization. And what we missed in there was the opportunity for innovation, because standardization and innovation are strange bedfellows. And when you're focused 100% on making everybody do it this way, you're really not doing much thinking outside the box or opening up the opportunity for that. So, as I mentioned before, we got a lot of juice out of the squeeze of standardization, but we really appreciate that that's not what's going to get us where we want to be, which is a world where children aren't harmed when they come in for healthcare. And so it's been part of our new strategy to try to really invest in innovation and start changing our mindset. So we're not just thinking about standardization, we're thinking about innovation. And of course, as we really step with both feet into a digital world as we have over the last decades and seem to even do even more so in the more recent years, we appreciate that there have got to be some great opportunities for digital innovations that would make children safer in hospitals.
So we have this challenge for anybody out there who is building or has built a technology or software that could help improve patient safety for kids or children's hospitals. We have some focus areas that maybe you can talk to us about what those ideas are. All this information's on our website.
Yeah, I really am excited about the possibilities. You mentioned the focus areas. We looked at the data and said, how are children most commonly harmed in Children's Hospital? What do we need to do to try to improve the ability to keep them safe? And there were 7 harm areas that emerged that we call our breakthrough harm areas. And I'll just list them for you. Central line associated bloodstream infections. We're looking both at ones that happen in the hospital and then also ones that happen in the outpatient or home setting that require rehospitalization and care. Unplanned extubations, when the breathing tube of a baby or child is inadvertently dislodged during their care. Nephrotoxic medication associated acute kidney injuries. So, trying to figure out better ways to protect children's and particularly their kidneys from medications that we know can harm their kidneys and alerting physicians that the medications are really putting the child at risk. Hospital acquired delirium. So, a really pretty sizable percentage of children who come into the hospital, particularly the ICU, experience delirium, and it's associated with really pretty significant long term consequences, not to mention the short term challenges that affect both the patient's family and the care team and really can get in the way of optimizing the child's care. And then there are 2 that are actually not focused on the patient, but are focused on the employee in Children's Hospital, because keeping employees safe is another really important part of the work that we do. And the 2 areas of focus, the first one are overexertions, and those are push-pull and overuse injuries, kind of musculoskeletal injuries. The 90-pound nurse moving the 200-pound bed or patient or medication cart or whatever it is. And then the last one is patient behavioral events. And this is when frontline providers, particularly nurses, are actually injured by patients themselves. So, an example that might resonate is a 16-year-old, 220-pound autistic child who breaks the nose of a nurse, or a child with a mental health problem who injures a care assistant, or something like that. So, those are the areas that we're most focused on, trying to foster innovations that would help us really make giant steps forward in reducing the rates of those types of harm.
What's great is you've worked with all of these hospitals from across your consortium and you've vetted these problems. You've fine tuned exactly what the problem is, why it's important, what the issue is that the hospitals, after all that standardization, can still work to improve. And so that's an important piece of work as we think about prioritizing the last bit that we need to improve in terms of a solution. So I encourage folks to look at the show notes and look at the documents we have listed in there. If you look at our website, you'll see the details behind what Anne's talking about. All these different opportunities for improving patient safety, why these problems are still unresolved even after all the standardization, and some ideas around technology solutions that could be helpful to hospitals and to doctors. We will have a team of experts take a look at the solutions that are presented. And then, Ann, walk us through. There's a time when your entire consortium comes together in May, right?
Yes, we're really excited about this. We're hoping that we get some very promising submissions. And what we would like to do is have a showcase of the top submissions at our national meeting, which is May 13th through the 15th, and really give the opportunity for those innovators to talk a little bit about the product and how they believe that will impact safety. And we'll have 500 or 600 representatives from across our network present. We're going to have them ring in on the innovation that's the most promising to them. The whole part of this process that we're really excited about is taking on an innovation and testing it in the children's hospitals. So it's a little bit of a competition to see what products are of interest.
Thank you for joining us and for talking about the exciting SVS KidsX Innovation Challenge. Excited to work with you and bringing these innovations to life.
Thank you so much.
If you want to learn more about the SVS KidsX Patient Safety Innovation Challenge, visit the KidsX website, kidsx.health, or look at the show notes. Applications are now open through the end of the month.
And now for your dose of dad jokes. I've got some football jokes for you today. How many Giants fans does it take to change a light bulb?
How many?
None, because they're always used to living in the Eagles' shadow.
Okay. We'll beat the Eagles this year, though.
Yeah, maybe. Why was Cinderella such a lousy football player?
Why?
Because her coach was a pumpkin.
That's good.
How do you know someone is a Giants fan? Don't worry, they'll let you know, especially if it's 2011 again.
Hey! A child gets diagnosed with a serious illness. His or her family unit, mom, dad, siblings, immediately jump into action, providing tremendous support, hope, love, and affection. They're the 12th man for that child as he or she goes through treatment. But this family unit, often they silently struggle with their own mental health. We heard Aubrey talk about this in an episode last season. Now, a mother-daughter powerhouse team are finding innovative ways to deliver family-based mental health care. Meet Rebecca Egger, CEO of a company called Little Otter. Little Otter has a cool backstory, so tell me how you all got started.
I founded Little Otter with my mom. She's my co-founder and the chief medical officer. My background is more in product and technology, design. I was a Palantir for many years and then the Chan Zuckerberg Initiative. Always really obsessed with this idea of how do you take incredible science and make it as accessible as possible through product and technology and really reduce complexity in data. And I had seen my mom's incredible career as a researcher, scientist, pioneer, especially in early childhood mental health, and felt like we had this huge opportunity to help parents and families understand, should I worry about my child's behavior? Is this normal? And what type of care do I need? Especially when access to specialized care is very limited across the US and really across the globe. This was an opportunity to figure out, how do we leverage technology and product to make it easier to empower parents and also give them information that is currently available to very few.
That's so true. I feel like people often rely on people they know in healthcare to get the access they need, but not everybody knows somebody in healthcare. And more so, do you know the right person, or do you know the person that can help you get the access that you actually need at the right moment? And that's not always the case. What is the process by which parents can figure out if their children are developing in a way that is clinically or developmentally normal?
My mom and her prior life before Little Otter developed the PAPA, which was still the gold standard used today, really a research and assessment tool that does a full interview to assess the needs of kiddos. There's a lot of also great screening tools. Tons and tons of research has been done in this space. And we took all of this previous knowledge and put it together into at Little Otter, what we call our family mental health checkup. So instead of having every single family get asked every single question for all of their kids, how do we focus on their children's ages, the questions that they're most worried about, concerns, etc. And taking that and turning it into the answers into a report for families that helps them understand, should I worry? What can I do as an in between step before they get referred to care or other types of support? What's so important to this is we all have been in the situation where we answer a lot of screeners or information and you never get feedback back or feel like even if things are normal, what can I do? And this is especially hard when we're looking at young children. And this is where my mom's expertise is. And what got me so excited about the opportunity to build Little Otter is how do you understand, is a tantrum normal, right? Or is, I have a 2-year old and her emotions are all over the place, but it's normal, right? But then sometimes she has some worries about new people or crowds. I've already used Little Otter myself in this context to understand, okay, is this starting to get out of the range of normal? How can I support my child and their mental health very early on? Because what most people don't realize is that young children suffer from mental health disorders, actually at the same rates as older kids and adults. And we have much, much better outcomes if we can identify these issues early. But the problem comes from the question you're asking, which is how do you actually identify these issues? And you have to have really age appropriate questions delivered to families and kiddos to be able to suss that out.
So with my kids, I remember when they were really young, every time a loud noise, like a fire truck would go by or an ambulance would go by or something else, they would immediately put their hands to their ears and cover their ears. And they were 2 or 3 at the time, I think. We didn't know if this was normal in terms of development. Was this a sign of a sensory processing concern to look into? We looked things on the internet. This wasn't something we wanted to call our doctor about because it wasn't interfering with her day-to-day activities or her life. It was just a behavior we noticed. And so it's interesting that you now created for parents and families a tool that allows them to look at various behaviors they're noticing in their kids on a regular basis and make sense of it in a way that allows them to figure out what they need to do.
Yeah, so we really use that as our internal triage tool. We initially give families a report. We hopefully try to make it as seamless as possible. But on the back end, from the results of that report, if a family decides that they're ready to get treatment or support at Little Otter, which is their choice, they sign up for a kickoff call and they will be sent further assessments and support based specifically upon their answers to the questions in the family mental health checkup. You don't have to fill out everything if it's irrelevant, but it's the next step in moving towards an actual diagnosis. So then you have your kickoff call, and then we match you to a provider and a care plan, which starts with a full diagnostic assessment. We are a very family focused product and service. So, again, that family mental health checkup isn't just about the child mental health, it's also about parent mental health, parent functioning, and family functioning. I always give this story because I think it's a great illustration for parents as they think about anxiety disorders, for example, which is most, I would say, people think about the improvement of mental health care around symptom improvement, right? So let's say you do have a really anxious kid who's refusing to go to school, they don't want to leave mom and dad, et cetera. If you keep that kid home from school, their symptoms improve, right? They're less anxious. But the family is not functioning. The parents are not able to go to work. Someone is having to stay home. Their maybe sibling can't go to school because you're having big fights every day to get the kid out the door. And so we actually measure family functioning as one of our primary objectives at Little Otter, which is, are they able to function and live their best lives together as a family unit? And that's what we're looking for at the end of treatment when we repeat the family mental health checkup, et cetera.
So will you provide treatment options for parents then as well, not only the kids?
Yes, we provide options for parents. We also do full diagnostic assessments for parents if they would like that. And then we also do parent training, which is sometimes with therapists and also with licensed BCBAs, which is a traditionally workforce that has been used to do ABA therapy, but many of them are trained in mental health care support as well. And they're fabulous at supporting parents with behavioral change and support. And actually, a lot of our parent programs demonstrate that you can have the same impact on child mental health just by working with the parents, especially with younger kids. You can improve a lot of those anxiety symptoms and reduce impact by just working with parents.
Now, will insurance pay for this type of treatment?
Yeah, we're a network with a bunch of insurance plans and then some Medicaid plans as well. And we really try to negotiate and get paid in ways that make it possible to deliver this family focused care. So we've actually been able to prove parent outcomes and child outcomes for insurance companies and partners. For example, just by treating the kid, you can get parent mental health to improve and vice versa. We're able to negotiate pretty interesting contracts with our partners where we're actually paid to provide outcomes on the family level. What I always joke is my sales tactic is Little Otter is like a 2-for-1 or even a 4-for-1 deal. You're paying for one treatment program and you're getting multiple folks better.
That's a very important way of thinking about it because one of the challenges, at least of pediatric healthcare, when we get a child at our hospital, we can treat them and bill for the services required to treat them. We can bill for the mental health needs of that child and the treatment related to that. But the siblings, for example, unless they're being treated by one of our clinicians, they're often not part of that plan. Parents are not part of the care being delivered by our clinicians. And so the idea that you get this bundle of services is really interesting. Rebecca, thank you so much for joining us and sharing about how you're bringing family based mental health care to the public and to the world. Appreciate everything you're doing.
Thank you so much. I appreciate being here.
Finally, if your child has ever had to have a blood draw or a needle stick, the experience is almost as painful for the parent as it is for the child. Dr. Manju Dawkins has created an innovative new solution to help take the pain out of needle sticks. Tell us what Thimble is.
So Thimble is a platform of products to lessen the pain and stress of needle procedures. So things like blood draws, medication injections, vaccines, you name it, we help make it easier.
Kids get blood draws all the time, or they get needle related procedures all the time. And I imagine the anxiety that is caused for both the child and the parent is strong. Tell us, how frequently does this happen? And why is it a problem that you specifically are focused on solving?
Yeah, it's funny because that is literally the origin story of Thimble. I'm a dermatologist by background, but when I had my first child and I took her in for her first vaccines, it was not the experience I'd hoped for. The moment she got stuck, she just looked up at me with just this look of pain and bewilderment and betrayal. Like, how could you let this happen to me? And, what strikes me about it, first moment of broken trust between mom and daughter, but also the first moment of broken trust between a pediatrician and her patient. It's important, and that really does have impact, not only just on the child, but on the caregiver and on the clinician as well. It's all a lot of bad feelings that we need to start to look at and address because it affects what people do going forward in life, like how they engage with healthcare.
So, how does it work? What's the process?
The whole intention was to have an over-the-counter accessible platform of products. So it starts with Prepare, which is a patent-pending patch that contains lidocaine, and it's specifically designed and formulated for needle procedures. So you just simply apply it before the shot to prevent the pain. And then to follow, there's the Recover patch, which is actually plant-based. So it contains turmeric and arnica, and you put it on right after whatever the injection was for, and you leave it on for 48 hours, and it lessens the bruising and soreness and ache for that amount of time. So instead of having to take a bunch of ibuprofen or acetaminophen, you use a plant-based patch. And then we know that needle aversion, it's not just about the physical pain, it's also about the emotional and psychological aspects. And that's why we have an app that puts together all the research-backed techniques and tools to lessen both needle pain and fear. So things like breath work, applied muscle tension, progressive muscle relaxation, distraction, and we just put it into an easy-to-use tool to guide people through the kind of emotional journey for any needle procedure.
And how do you know it's working? What's the science around the product itself?
So everything we've built is based on the research that's been done, largely by actually a Canadian pharmacist named Dr. Anna Taddeo, who has been working on this for decades now. And she basically really codified what are the things that help with needle pain, what are the things that help with needle fear, and in what order, like what is the kind of power of each of the interventions. And one of her 2015 papers suggested that numbing the skin is the most important thing because, yes, most humans do not like pain. But even if it's not the pain itself that bothers patients, it is often the trigger that reminds them about all the other parts of the needle procedure that they don't like. And so that's why we started with the Prepare patch. And yes, that was the most difficult thing to develop. It's taken years to get here, but we felt that it was important. And then everything else is also backed by what the research dictates is necessary. I'm always looking for partners who are interested in this. What is the impact? How are we going to show that, yes, we can increase the rates of vaccination? We can increase how often we're screening for lead poisoning in our patients. There's so much opportunity to show how when we show compassion for people's feelings about needle procedures, how it impacts their health, how it impacts public health.
What's next for you? Where does Thimble go from here?
We are available on our website at thimblehealth.com, but our intention is to change the standard of care for needle procedures. So, yes, we're HSA, FSA eligible. Yes, we're here for families right now, but really the ultimate intention is for systems to be providing this for patients. And I think that what will quickly be shown is that this isn't just good for patients, it's not just good for caregivers, it's good for the actual institutions, right? Like when everybody is staying adherent to all the care that is necessary, it saves the entire system money. It saves the entire system time. And I'm just really excited for people to see the benefits of something that is so simple.
Dr. Dawkins, thank you so much for coming on the show and telling us about Thimble.
Thank you so much for having me.
All right, thank you for joining us for your dose of optimism. Make sure to check out our show notes to get more information about our guests and the work they're doing. Visit our podcast page on the KidsX website to join our podcast community and to learn more about pediatric innovation. Thank you to our sponsors and to our presenting partner, KidsX. Please subscribe wherever you get your podcasts, and remember, it takes a village to make sure our kids grow into healthy adults. So volunteer at your local library, help out at the community center, and if you're so inspired, donate to your local children's hospital. All right, see you next time.
The content, views, opinions, and information presented on this podcast do not reflect the views of Children's Hospital Los Angeles or of the sponsors of the podcast.